And then, of course, you have the disaffected Vietnam veterans who simply got mad at the federal government and just refused to sign up and never have. What's significant about the Vietnam population is that they have now reached 65. There is currently a boom in the population of Vietnam veterans re-entering the VA system. Men and women who for the last 35 years were working, were raising families, were getting on with their lives, had health insurance through their employers, but now they're 60 to 65, they're getting ready to retire, they've lost their employer-provided health insurance, and they remember, hey, I served in Vietnam, I'm going to go apply for my VA benefits. So they have re-entered the system, which puts a whole new load on the federal VA, and that not only is the federal VA not prepared for the 1.4 million GWAT veterans coming home, they were not prepared for the over, I believe it's, let me just get the number correctly, 8 million Vietnam era veterans coming back into the system. The other aspect of the VA not being ready for that is that the needs of our Vietnam era veterans are not the same as the needs of our younger veterans. 10% of the veterans living in our 4 veterans home in Illinois, which are long-term care facilities, are already Vietnam veterans. These are the most ill. The major illnesses with the Vietnam veterans in that 60 to 65 age group is diabetes, hypertension, heart disease. You're going to have all the amputations that come with diabetes. And you're beginning to see a lot of cancers as a result of Agent Orange. So a lot of these cancers that take 30 years to develop as a result of Agent Orange exposure in your 20s are just now showing up among the Vietnam veterans. The VA is somewhat better prepared to handle those illnesses than they are the illnesses and the injuries of the veterans of my generation. So you have a VA that has been taking care of World War II and Korea War veterans, basically geriatrics, for the last 20, 30 years. Suddenly they have middle-aged veterans coming back into the system, demanding access, demanding to the benefits that they rightfully earned, and they're not able to access those benefits. What more, the expertise is not there. The expertise needs to be newly developed, but they need the help now. A good example is the fact that many of our Vietnam veterans are suffering from post-traumatic stress disorder that they have repressed their entire adult lives, because it's easier to put that stuff in the back of your mind while you're raising your family, you're paying for your kids' college. But now that they're retired and they're no longer working, they sit at home. They have free time on their hands, so they start to travel, and it's time to relax, and that's when the memories come flooding in. Then they turn on the news, and they see what's happening in Iraq and Afghanistan. And except for the colors not being all different shades of green, instead of their shades of tan and brown because it's the desert, but it's essentially the same kind of guerrilla tactics and warfare, they are re-experiencing all of those emotions. So we're seeing a real spike in the needs of our Vietnam veterans with post-traumatic stress disorder services. There simply are not enough VA-trained mental health professionals that can deal with post-traumatic stress disorder stemming from combat. They're just not ready. They're completely overwhelmed. Another difference between Vietnam veterans and younger veterans, especially with post-traumatic stress disorder, is, I think this is a positive thing, and that is that the families, and especially the spouses of our younger veterans, are not standing around waiting for whatever the fallout is with their loved one from PTSD. We're seeing a real spike in wives calling in, demanding spousal counseling, marital counseling, forcing their husbands to come in, something that did not happen as much 30 to 40 years ago when the Vietnam vets came home. But the younger spouses today are much more savvy. They have more of that information, and they are demanding those services. So in part, a large spike in the need of post-traumatic stress disorder, and that demand is coming from the family members who are much more savvy today and are demanding it. So what does this do to the VA? What it does is it creates a 600,000 case backlog of people waiting to have their benefits approved. What that translates to is anywhere from a 12 to 24 month waiting period from the time you submit your packet to the VA asking for the VA to recognize you as being combat disabled or service disabled. In that time period, you do not have access to VA services. So You're a Vietnam veteran, you're starting to have flashbacks, you're starting to have nightmares. You call the VA, you go back in, you fill out the paperwork. Now you wait 2 years until the VA finally decides or gets to your case and says, okay, you are combat disabled. 2 years later is when they can get into the VA to get help for their illnesses. Post-traumatic stress disorder, cancer, diabetes, these are not illnesses that can wait 2 years to be cared for. These are illnesses that need to be taken care of immediately. And so we're seeing a real backlog. We're seeing veterans frustrated, family members frustrated, and all at the same time, you have the young vets who are coming home. They're coming home from places like Walter Reed, where they received absolute state-of-the-art, best care possible. Despite everything that you heard about what happened at Walter Reed, those were administrative issues. The medical care is the best in the world. I was there for 13 months. I was used to standards set for me at Walter Reed that were set so high that when I walked into my VA hospital, I was just set up to be disappointed because they simply were not ready. I'll give you an example. My prosthetic legs. When I woke up at Walter Reed, within about 2 weeks of waking up from my coma, I had therapists at my bedside who looked down at me and said, "Okay, it's time to get to work. What are you going to do? What do you want to do?" And like every other soldier, every other Marine, every other airman, I answered the same way. I want to get back to my unit. They said, "Well, okay, but a year from now you will be running the New York City Marathon." And they were not kidding. And it was that whole, will I ever play the piano again? But I didn't run the New York City Marathon before I was blown up. Why should I start now? But that's really the expectations. Every amputee at Walter Reed is expected to participate in the New York City Marathon before they leave, because there's a partnership there with the Achilles Track Club. In whatever way, whether you're in a wheelchair, a hand crank bike, or something, you are expected. But that's the standard. Yet I walked into my VA hospital's prosthetics program, and what they said to me was like, "Wow, we think it's a great thing if we can get our veterans to stand up and shuffle to the chow hall for lunch." And I'm talking to them about running the marathon. So the expectations are so different, not just because of where they're resourced, but also of the population, and also because of the extremely high level of care my generation is getting. So the family members and the veteran themselves are expecting this level, and they're having to settle for something much less, and they're not satisfied with that, which is where the states come in. In Illinois, in this 2007, Governor Blagojevich and our legislators have actually given us, veterans in Illinois, over $50 million in new programs really targeted at young veterans in 2007 alone. $50 million. That's a single state. And we're basically being forced to take on a lot of the burdens, the cost of the war that the federal government simply is not meeting. I'll give you some examples of some of these programs. We have a $600 tax credit for employers. This addresses the National Guardsmen and Reservists. Any employer who hires a veteran of Desert Storm, Iraq or Afghanistan, starting in 2007, gets $600 back from their state of Illinois income taxes per veteran. So if they hire two, they get $1,200, etc. And that's to help those veterans access employment, which is one of the top 3 problems our young veterans are facing today: employment, housing, and medical care. So we have the only program in the entire country that offers a $600 tax credit to employers.